Welcome to Copilot Podcasts. Every minute, 2 million brain cells die during a stroke. That's the equivalent of losing 4.2 days of healthy life every single minute. Today, we're diving into how artificial intelligence is revolutionizing stroke care, from lightning-fast diagnosis to personalized recovery. You'll learn why AI might be the breakthrough we've been waiting for in saving brain cells and lives.
And those numbers really underscore why speed is absolutely critical in stroke care. We have this saying in neurology, time is brain. Every second counts.
Let's start with diagnosis. How exactly is AI changing the game there?
Well, according to recent studies, AI systems can now analyze brain scans in seconds, identifying stroke types and affected areas almost instantly. The Mayo Clinic, for instance, is using AI algorithms to speed up stroke detection and coordinate care teams.
That's incredible. And I understand the results are pretty dramatic?
Yeah, absolutely. The latest data shows that AI brain scans are helping about half of stroke patients make a full recovery. We're seeing treatment times reduced by over an hour in many cases.
An hour? That's a lot of brain cells saved.
Millions of them, actually. And you know what's fascinating? The AI systems aren't just faster, they're getting remarkably accurate at predicting outcomes too.
Can you give us an example of how that works in practice?
Sure. Let me tell you about a real case from the Mayo Clinic. A woman named Sophia Chan suddenly developed a severe headache at work. By the time first responders arrived, she was unresponsive.
Oh, wow, that's terrifying.
It was, but because they had AI-powered systems in place, they were able to diagnose and begin treatment incredibly quickly. In cases like hers, every minute saved can mean the difference between recovery and permanent disability.
It's interesting how AI is kind of mimicking what our brains do naturally, pattern recognition, quick decision-making.
That's a fascinating observation. And in some ways, AI is actually surpassing human capabilities, especially when it comes to analyzing complex imaging data.
Let's talk about treatment. How is AI helping doctors make decisions about what to do once they've identified a stroke?
Well, according to recent research, AI systems are now helping determine the best treatment approach by analyzing multiple factors simultaneously: imaging data, patient history, vital signs, all in real time.
That must be incredibly helpful for doctors working under pressure.
Absolutely. And what's really exciting is how AI is helping with something called thrombectomy decisions, basically, determining whether to surgically remove a blood clot.
And how accurate are these AI systems?
Recent studies are showing accuracy rates between 85 and 98% using various AI models. That's particularly impressive given how complex stroke diagnosis can be.
Those are remarkable numbers.
They are. And you know what's really interesting? Some AI systems are now using gaming technology for rehabilitation.
Gaming technology, how does that work?
There's this fascinating system called the rehabilitation gaming system. It turns therapy exercises into engaging games that adapt to each patient's abilities.
That sounds like it could make rehabilitation more engaging for patients.
Exactly. And there's currently a major clinical trial underway testing this approach with 192 participants across Europe.
Let's talk about remote monitoring. That's becoming increasingly important, right?
Absolutely. The pandemic really accelerated this. One survey found that virtual care in physical therapy jumped from 6% to 94% adoption in just 2 years.
That's a massive shift.
And what's interesting is that 64% of therapists said they'll continue offering virtual care even after the pandemic.
How does AI fit into this remote care picture?
Well, researchers are now using AI to analyze data from wearable sensors that patients can use at home. These sensors track movement and progress during rehabilitation.
So it's like having a virtual therapist watching your progress?
In a way, yes. The AI can detect subtle changes in movement patterns and adjust therapy recommendations accordingly.
That could really democratize access to stroke care, couldn't it?
Exactly. Especially for people in rural areas or those with mobility limitations who might struggle to attend regular in-person sessions.
Are there any challenges we need to overcome?
Several. Data privacy is a big one. We're also dealing with issues of AI bias and the need for extensive validation of these systems.
Can you elaborate on the bias issue?
Well, if an AI system is trained primarily on data from one demographic group, it might not perform as well for others. This is particularly crucial in healthcare.
That's a really important consideration.
And it's why researchers are emphasizing the need for diverse, representative datasets in AI development.
What about the cost factor? Is this technology accessible to most hospitals?
That's another challenge. While the long-term cost benefits are clear, the initial investment can be substantial.
But I imagine the potential savings in terms of better outcomes would be significant.
Absolutely. When you consider that faster treatment can mean shorter hospital stays and better recovery outcomes, the return on investment becomes quite compelling.
Let's talk about the future. Where do you see this technology heading?
Well, researchers are working on even more advanced AI models that can integrate multiple types of data, imaging, clinical signs, and even molecular markers.
That sounds incredibly comprehensive.
It is. And we're seeing the development of what's called federated learning, where AI systems can learn from data across multiple hospitals while maintaining privacy.
That could really accelerate improvement in these systems.
Exactly. The more data these systems can learn from, the more accurate and reliable they become.
What about personalization? Is AI helping with that?
Yes, that's one of the most exciting areas. AI can help create highly individualized treatment plans based on a patient's specific characteristics and progress.
That must be particularly valuable in rehabilitation.
Absolutely. Every stroke patient's recovery journey is unique, and AI is helping us better understand and support those individual paths.
Are doctors generally accepting of this technology?
There's growing acceptance, especially as the evidence for its effectiveness builds, but there's still some natural caution, which is healthy.
I suppose it's about finding the right balance between human expertise and AI assistance.
Exactly. AI isn't replacing doctors, it's empowering them to make better, faster decisions.
What would you say to healthcare providers who are hesitant about adopting this technology?
I'd point to the data. When we're seeing AI help achieve 48% full recovery rates compared to previous standards, that's hard to ignore.
Those numbers really do speak for themselves.
And remember, every minute saved in stroke treatment preserves millions of brain cells. That's what this is all about.
As we wrap up, what's the key message you want our listeners to take away?
The AI in stroke care isn't just about fancy technology, it's about saving brain cells, saving function, and ultimately, saving lives.
And doing it faster and more precisely than ever before.
Exactly. When every minute counts, having AI as an ally can make all the difference.
Well, that brings us to the end of today's episode of Copilot Podcasts. Remember, in stroke care, time is brain, and AI is helping us save both. Thanks for listening.